I have done the interview. I have interviewed Dr. Sunil Narayan, sir, who is an esteemed neurologist, and he's actually the professor and head of neurology at JIPMER, and he's MD/DM PhD. Very nice gentleman, and within 20 minutes of our discussion, it was really eye opener for all of us. So, without wasting much time, I'll ask RX7 to play the interview. So, a very good afternoon, one and all. And at the outset, I must thank the organizer of National Update of Clinical Diabetes, especially Dr. Alok Kanango sir and Dr. Ashok Das sir for giving this opportunity. And today, the symposium theme is brain and diabetes. And we all know that the brain has so many links with diabetes, starting from the ominous octet, what DeFronzo has told. Out of the 8 factors, one is the biochemical or the neurological abnormalities is one of the component. Plus, we also know that diabetes per se can lead to various oxidative stress. The insulin resistance can lead to a lot of inflammation, and that can affect the neurological symptom. Apart from the typical diabetic neuropathy, which we always read. So, to discuss on that, we have the next 15 minutes where we'll have a candid talk with a very famous personality in the field of neurology. And it is my utmost privilege to introduce Dr. Sunil Narayan sir, who is a doyen in neurology, and he's MD/DM and is currently professor and head of neurology and the stroke program of the prestigious JIPMER Pondicherry. He is also the chairman of the stroke subsection of Indian Academy of Neurology, and he has got many awards to his credit, and you can see in his slides in due course of time. So, without wasting much time, I'll just start the candid discussion, and it would be without slides. So, we'll just have a discussion actually how diabetes has got its effect on neurocognitive disorders. So, sir, a very good afternoon. And the first thing which I wanted to ask is that how does diabetes cause different cognitive decline? So, what's your opinion on that?
Yeah. See, the disease diabetes really undercuts the very source of all our energy source of all our activities. That is, human beings are primarily dependent upon the glucose molecules and, of course, the ATP and other molecules which directly provide that final energy source. But if there is a condition such as diabetes, which undercuts the very metabolism of carbohydrates, especially the way the glucose regulation happens in the body, definitely and directly interferes with the energy supply. And of all the various organs in the human body, the organ which consumes maximum amount of glucose, oxygen, or even blood flow is human brain. If you take the blood flow or oxygen consumption per weight, it is the organ. And this is understandable because it is the human brain is the most evolved of any machinery in the entire universe, to at least to our knowledge. So all working system needs energy, and a disease like diabetes, which interferes with this energy production and its regulation, invariably interferes with the functioning of the brain and neurons. And just like any other system, it affects directly when there is low sugar like hypoglycemia, or very high sugar like hyperglycemia, and also because of the chronic effects of dysregulated glucose pathways, dysregulated citric acid cycle pathways, mitochondrial energy, bioenergetics mechanisms. All these mechanisms are disrupted, especially the long-standing diabetes, and just like any other system, brain is also affected, not only secondarily through other pathway, but also primarily. We will go into that as we discuss how exactly this happens. We can't hear you.
Yes, sir. Yes, sir. Yes, sir. Sorry for that. So, in that context, actually, as you have rightly told, that brain requires glucose for its functioning, and we know that glucose is an important fuel for brain. So, what are the types of or the incidence of neurodegenerative diseases that affect diabetes? So, what are the spectrum of neurodegenerative diseases?
I think if you look at the commonest kind of neurodegenerative disease, which is affected or by diabetes, it would probably come down to the vascular dementias, just because the vascular diseases are extremely common, and though hypertension itself is also a very important cause of small vessel disease and even large vessel disease through atherosclerosis and other mechanisms. The role of diabetes in producing vascular diseases, especially the lacunar strokes, the various white matter degenerations, which happens, which slows down the entire cognitive process. But if you look at by the sheer amount, this will be the commonest condition. But even the next common cause of dementia, probably, if you look at the world over, is what we generally call it as Alzheimer's disease, a condition which probably has got very important genetic underpinnings, because there are genetic mechanisms which predispose the person to develop what is called the deposits of beta amyloid and tau proteins, and the more microscopically visible structures like neurofibrillary tangles, which interfere with the neuron-to-neuron communications, the neurotransmitter production, and also the new sprouting of dendrites from the neuronal cells, and even the energy supply of the neurons through the supportive glia. All these are interfered with in a long-standing diabetes, which we call the condition called as type 3 diabetes. And this kind of a diabetic status first leads to the production of amylins, which is closely linked to the beta amyloid we see in Alzheimer's disease. So there is a direct relationship between the long-standing diabetes and the predisposition of and the development of Alzheimer's disease in somebody who is already predisposed to develop Alzheimer's dementia. So there is an acceleration process. We all now know that Alzheimer's disease is multifactorial. Just like our ancient saints in India and our ancient Ayurveda physicians told, the prakriti of a person determines what kind of disease they develop. So there is a genetic predisposition nowadays to every cause, every disease, and the risk factors and the acute precipitating causes are all can modify these basic genetic predisposition to diseases. And amyloidosis is the Alzheimer's disease is no exception. And here, diabetes is one of the most important risk factor and a predisposing condition to develop Alzheimer's disease in someone who is already having a latent Alzheimer's disease or is genetically prone to develop Alzheimer's disease.
Right, sir. I think that's a very good concept you have told, and you have also rightly mentioned that there is an entity which is known as the type 3 diabetes, and we call Alzheimer's as type 3 diabetes because diabetes is one of the most important predisposing factor and also a risk factor for this kind of neurodegenerative disease like Alzheimer's disease. So, coming to another question, which always comes to an endocrinologist's mind and also a diabetologist's mind, is that what is the role of insulin and insulin resistance? So there are concept of insulin inside the brain and insulin resistance in the brain. So how does it affect the neurocognitive functions?
Yeah, it's very interesting that after so many years of our knowledge and our familiarity with this molecule ever since the time of that Nobel-winning discovery of this molecule, the total knowledge about insulin even today remains enigmatic. See, the people think that if we control diabetes very well, including some of the latest mechanism of treatment by intranasal insulin, etc., you could somehow slow down the development of Alzheimer's disease, especially in murine experiments. But at the same time, there is also a very strong school of thought. Insulin and pro-insulin can also could even be a kind of a culprit where simply by increasing the insulin, it does not always help the process. It could even harm and can even lead to the progress of many of these degenerative diseases and metabolic syndromes. So even though huge amount of research is going on, this is still a gold mine. We are yet to know whether how we can use insulin molecule in the best possible way, in the best controlled way in any given scenario to not only to control diabetes, but also to prevent and manage in someone who has already developed dementia, including Alzheimer's and multivascular dementias, leave alone the other causes of dementia. For example, diabetic renal failure can produce uremic encephalopathy and chronic dialysis, dementia, etc. So there are a huge number of ways we can control. And is insulin always a savior? Well, we now know that's not the case. We do know that insulin is double-edged weapon, and we have to come out with a finer or more refined forms of this molecule, which can do more health than harm. So that is where the research stands now, as far as I have understood it. It's a very challenging area even now.
Absolutely, sir. So, this is a very controversial and topic, but it's challenging to see whether insulin is going to help or it's going to do more harm. And insulin resistance is the predominant factor in this kind of neurodegenerative disorders. Sir, we all know that a good glycemic control actually benefits the reduction of the microvascular complications like retinopathy, nephropathy, and neuropathy, and to some extent macrovascular complications also. But what's your opinion about whether a good glycemic control can actually lead to a better cognitive outcomes or a better outcome in this neurodegenerative disorder? So what's your opinion, sir?
And there is absolutely no doubt in the fact that an excellent long-term glycemic control and also prevention of any kind of excesses like hypoglycemic and hyperglycemic episodes, these can definitely, unequivocally reduce the any ongoing damage to the microvascular system, to the large vessel health, and also to the direct brain cell injuries. So there is no doubt that good glycemic control is always help, irrespective of the role of pro-insulin and insulin on the condition. Glycemic control is of paramount importance. So there is no two questions on that, actually.
Right,
Maybe
sir.
we need other molecule. We have now a huge armamentarium of drugs available to us. That's a great boon, and people are working on it. And I'm sure that the human mind, when challenged, it has no limits. So I'm sure that we will be able to come up with better and better molecules which could provide the best glycemic control, as well as the best techniques to decelerate atherosclerosis and lipohydrosis and other vascular damaging mechanism, and also to provide the best bioenergetic at the mitochondrial and at the cellular level, making the transmitter production, the synaptic activities, as well as the new neuronal and dendritic sprouting, and all these mechanisms which helps the brain health maintain as good as possible. So we need to continue to encourage development of better and better molecule with lesser and lesser side effects. Maybe we may have to take a step back from the insulin and look for even more exciting newer molecules.
Thank you, sir. So I think we have another 1 or 2 minutes left, and I don't want to lose the opportunity to ask another very common question, actually. So you have told about good glycemic control can actually reduce the neurodegenerative disorder. So as a neurologist, I just wanted to ask or inquire, like, what are the other ways of preventing and treating this neurodegenerative diseases in patients with diabetes? So anything to suggest? And the final comments.
See, Alzheimer's disease, sometimes we call it as you said, the type 3 diabetes, is not the only neurodegenerative disease which is related to diabetes mellitus. In fact, even though there are controversies and people do think that sometimes there is a protective role of the diabetes in ALS. The data by and large suggests that if an ALS person also has diabetes, the chance of his deterioration is worse, because muscle weakness also ensues in diabetes due to other causes. And the same way, conditions like Parkinsonism, where there is autonomic dysfunction in the later stages, again is worsened by diabetic neuropathy. And we have even other diseases like Huntington disease. All these neurodegenerative diseases, the basic problem is the neuronal deaths at the specific areas of the brain and the transmitter deficiencies, and any condition which interferes with the brain's energy metabolism can affect these neurodegenerative diseases in an adverse manner. What else can we do? If you ask that, basically making our system as young as possible by daily sufficient physical activities, daily sufficient relaxation, including good sleep. And sleep especially is very important, because it is during certain stages of the sleep that the lymphatic pathways remove the amyloid and other scavenging mechanisms happen in the brain. So good sleep is important. Good exercise and physical activities are important. And also green leafy vegetables and limited amounts of healthy non-vegetarian food like fish, and consumption of ensuring that you do get good air to breathe, and live in less polluted atmosphere, use clean water as far as possible. So all these principles of healthy living certainly helps to keep the brain also healthy. Brain health is a challenge for not only as physician, but for entire humanity. And when we go green, the direct beneficiary is brain health, and the brain also can influence the other systems of the body, including the endocrine system, in the reverse direction also. So I think we should all go into this principle of promoting the greener ways of living, the healthier ways of living, making the whole human system, including the brain health, and which also for which it's also extremely important to control a major metabolic disease like diabetes, which has got its roots spread all over the human physiological systems.
So thank you, sir. That was an excellent and candid interview with a doyen in neurology, and it's an eye opener for all of us. So thank you again. So we discussed about the causes of neurodegenerative disorders in diabetes. We discussed about what is type 3 diabetes. Then we discussed what is the role of insulin, and then we discussed how we can prevent and treat this kind of condition. So thank you again, sir, for those wonderful pearls of wisdom. Thank you again.